The condition that I got to research was cerebral palsy. Now, this condition kind of explains itself within the name of it because cerebral means brain and palsy means the weakness of your muscles. So, what is cerebral palsy? This is a condition that is caused by abnormal development in the brain that controls your motor movement and your posture stance. So, a lot of people who have cerebral palsy have a really hard time with motor skills and with even just like a normal posture. Their gait walk is usually abnormal as well. The estimation is about 764,000 people are affected by cerebral palsy. About 10,000 babies are diagnosed with this a year. And this is, however, a permanent disorder, but it does not get progressive. The causes of cerebral palsy. This is caused by damage to one or more areas of your brain. There's not only one certain cause or one problem. People normally think it's with your muscles and stuff because of their motor skills are not very equivalent to those who do not have cerebral palsy, but it is not caused by problems with the muscle, but instead the development of the damage to your motor areas in your brain. There's certain things that you can get. 70% people who have cerebral palsy, it is a result from brain injury in the intra-life of birth, and then the other percentage is during your birthing process. Now, there are different things such as infections, meningitis, jaundice, and then even car crashes. People who get in really bad car crashes and have brain trauma, that can cause cerebral palsy as well. There are different risk factors that will put your child or your baby at risk for cerebral palsy. Here's just a few of them. As you can see, premature birth, I have a picture of a premature baby. That can be a big risk factor for your child to develop cerebral palsy. Therefore, your child is not fully developed, so is premature. And that goes along with low birth weight. Usually premature babies weigh 3 to 5 pounds, and that is a really low birth weight for a child. Also, different infections that you can get during pregnancy. If you have any type of birth complications, and if the baby is to develop jaundice and is not treated right, they can also develop brain damage that will cause cerebral palsy. Now, as far as treatments go, there is no specific treatment for this disorder because, like I said earlier, this disorder is permanent, so you can't really treat it. The only thing you can try to treat are the symptoms that come with it. So how they explain it is it's more manageable, and you have to manage this instead of being able to treat it. There's no actual cure. So you just have to work with the symptoms that is given to this child when they have this disorder and figure out ways that they can live out a normal life and be successful. There's different types of medications, surgery, and even braces that you see a lot of cerebral palsy students wear. As you can kind of see in these pictures, they have braces for their legs and ones that go around their arm to help them walk because they do have a abnormal gait, so they are not able to walk normal on by themselves. But the objective of the treatment or the management plan that is made for these kids are to give them the opportunity for independence and to be successful at life in a normal society. Now, the effects of people with cerebral palsy. Like I said earlier, cerebral palsy is a disorder that is from the brain. This does not have to be. This is not a disorder that hurts your muscles or your nerve system. This all comes from your brain. So, different effects of people with cerebral palsy is the inability to a full motor control. Like they are not able to sit up straight, not able to walk by themselves. They have really bad involuntary movement, disturbance in their gait. Like this picture shows too a little girl that's walking with almost like little canes on both arms because her gait is so bad. depending on the area of your brain that is hurt is what's based off the kind of effects and damage that is being done. Problems that can occur when you have cerebral palsy is these students are prone to seizures, abnormal sensations, problems breathing due to their posture. They're not able to sit up straight and give them an airway to be able to breathe, and then also learning disabilities. The prevention of cerebral palsy is kind of slim because there's not a lot. It's due to preventing things that happen during birth and when you get pregnant with a child. But there are measures of preventions that are being increased daily. There's research being done every day trying to get more preventions so we have less babies and less kids with cerebral palsy. So there's new tests and medications that are constantly coming out. Women who are pregnant are usually tested regularly for HR factors. Now, if this is tested negative, they are able to be immunized within 72 hours after they're given birth to kind of help prevent the blood inconsistency. Like I said, there are a lot of measures being taken. They're trying to help prevent prematurity, trying to lower that rate of premature babies, which I know is probably something that's really hard. But they are working on more research and more preventions as of today. Now, as far as a physical education teacher, what you need to know on how to teach these students that have cerebral palsy in your classroom, you need to make sure that you know your student. When you have a student with cerebral palsy and their IEP plan is getting written, you need to sit in with those teachers and therapists and everybody in the school and help write their IEP plan, because physical education is a part of their daily life too. So we need to make sure that we want to learn and we want to know about what limitations and what modifications we need to make for the student. There are a lot of certain guidelines to follow. You need to make sure that you are able to make adaptations. Now, adaptations need to be to planning, equipment, and the environment that they are in. As far as making adaptations to planning, make sure that you plan ahead. Like I said, make sure you read their IEP plan. Make sure you know what this student can and can't do, their motor functions, what they are able to successfully do, what they need help on, and what they might even need like a partner or extra help in. Also focus on planning on that individual and not on their disorder, because you want to make your classroom as inclusive as possible, where everybody is participating in the same thing. And you don't want to point them out for their disability. You want to be able to focus on the individual. The next modification that you need to make sure you're doing is equipment, making sure you're adapting the equipment to this student. Be aware and modify based on the student's needs. A lot of times they have motor skills because this is the disorder. Use equipment that will make them successful, and apply everyday accessories. Using things that these students will use every day to help them will be a big help and help these students be successful. One example is using a ball that, say you're playing throw and catch with a partner, get their ball and put Velcro on it, and that will help them be able to catch the ball a little easier. But just applying everyday accessories and making sure that you're enabling the fact for these students to be successful. And the last thing that you need to make sure that you're adapting to is the environment. You want to have almost a normal environment so these students don't feel left out. They feel like they're part of the everyday society. You want a normal and fun environment. You want to try to keep them in the least restrictive area. Yes, they might be using different equipment, but they can also participate with all the other kids. Even have some of the other kids participate with this modified equipment. And always have you always want to have a positive environment, whether you're teaching disabled kids with cerebral palsy or autism or hearing disorders or anything. You always want to make that positive environment so your kid feels welcome and they want to learn and they want to be successful. Now I have a little YouTube video that I'm going to show. On physical education with a cerebral palsy student. If I can get to it. As you can see, they're using a bouncy ball.
Kyle.
Well, they were using a bouncy ball for bowling.
2 callers. Die. Blue.
As you see, this environment is positive and involves everybody. Yoga. Once again, look at the equipment, how it's modified, bowling, and they're using bouncy balls to help these students.
Yellow. Blue. Purple. Tie-dye.
Now, these are just certain things that you can do in a physical education classroom to help your student that has cerebral palsy. I hope you guys learned something new about cerebral palsy. I know I learned a lot, and I can't wait to incorporate these things in my own classroom.